be doing my head to toe assessment today. Unfortunately, I was unable to use the facility where I work, so I'm performing this assessment in the comfort of my home. So first of all, I will come into the room. I will knock, come into the room, provide privacy for my patient, and I will identify myself to my patient. Hello, my name is Sarkeisha McCarroll, and I'll be performing a head to toe assessment on you today. And I will ask my patient for his name. Can you please tell me your name?
Steve.
Okay, can I see your wristband? All right, thank you. Do you know what year it is?
2019.
Do you know where you are right now?
Yep, in the house.
In the house? Okay, can you tell me what's the current season right now?
It is summer.
Okay, he is alert and orange at time 3. You can move over. He is alert and orange at time 3. Next, I'm gonna inspect his head and then we'll proceed forward. First, I will check his head. I will feel for any lesions, any nodules, or and look for any abnormalities. I will look at his hair distribution. And are you feeling any pain as I palpate your head?
No, ma'am.
Okay. So next, I will palpate his sinuses here. Do you feel any pain when I do this?
No, ma'am.
Okay. And his eyebrows are symmetrical on both sides. His nose is symmetrical. Can you move over, please? And his nose is symmetrical. And he has equal hair distribution on both sides. His ears are equal bilaterally on both sides. And next, I'll be inspecting his ears. So I will inspect his ears. Can you move your face over? Thank you. I will inspect his ears. Do you have any pain when I press on it?
No, ma'am.
Okay. No drainage noted on the side. No lesions noted. And then I'll proceed and do the other side. Do you have any pain once I press on your auricle here?
No, ma'am.
No? Okay. No drainage noted on this side as well. Next, I'm gonna palpate his lymph nodes, his occipital, which is here, his post-auricle, and his pre-auricle, and underneath. Do you feel any pain once I
No, ma'am.
maybe like this? No? Okay. Any pain?
No, ma'am.
Okay. Next, I'm going to be looking at his eyes. So, I'm going to shine a light in your eyes. Just look straight ahead for me. Okay. And again on this side. Okay. And look straight ahead for me. Okay. Pupils are accommodated to light. Next, I want you to focus on my hand right here. And I want you to just let your head stay still and just follow along with my hand. Your eyes, just your eyes. Okay. Okay. Patient pupils are equal, round, and reactive to light. Can I have you look up for me? Well, first I'm gonna sit this down. Can you look up for me? And sclera is white. Look down for me. Okay, sclera is right. Iris is white. Sclera is white, and he has pink conjunctival. Do you have any pain once I press on the iris?
No,
Lacrimal iris? No?
No, ma'am.
Okay. So as far as your nose, I'm going to take a look up your nose now, okay? So I'm going to look for any lesions, no drainage noted, any pain once I press on it? No? Okay. So I'm going to have you just blow for me. Okay, blow again. Okay. Can you open your mouth for me? Stick out your tongue. Okay, it's pink and moist. All teeth is in his mouth. No lesions noted. Can you stick your tongue out, please? Say ah. Okay. Uvula retracts, and the tonsils are seen, and they're normal. Do you have any pain, any dryness, mouth dryness?
No, ma'am.
No. Okay. Next, I'm going to feel for his carotid artery. Okay, now feel the opposite side. Okay, And next we're gonna move down. And well, first of all, I'm gonna have you stretch your shoulders for me. Okay, can you make a frown in your forehead for me? Smile, frown. Can you stick out your tongue? Okay. Can you wiggle back and forth your tongue? Okay. Can you please close your eyes shut for me really tight? Tight. Okay. So patient cranial nerves intact. And next we're going to move down and proceed with his breath sounds. So I'm listening to his breath sounds. Take a deep breath for me. Okay, deep breath. Deep breath. Deep breath. Again. 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 One more time. Okay, while I'm doing this, I'm going to go ahead and listen to his heart sound. First, we have our aortic, rhomatic, Erb's point, tricuspid, and mitral valve. Also, I can repeat the steps by listening with the bell of the stethoscope to test for a murmur. I would do the same steps as I did when I was listening to the heart sounds. And also, to count the patient apical pulse, I can also have him lay on his left side and count for 1 full minute. Right now, I'm going to have the patient turn around so I can assess his his lung sounds from the back. So if you would just spin around for me. Not the chair, you, please. Okay. So next I'm going to show you how I would listen to his lung sounds. And put your arms down to your side for me. Thank you. Have a deep breath for me. And we start at the apex of the lung. Deep breath. And come around, Damien. Again. Deep breath. Deep breath. Deep breath. Again. 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 And again. Okay. And take a deep breath for me. Okay, and it's equal on both sides. Do you feel any pain here? No? No pain noted?
No, ma'am.
Okay. And let me know if you feel any pain once I listen for your kidneys, okay? When I check your kidney. Any pain?
No, ma'am.
Pain?
No, ma'am.
Okay. So I'm gonna have you turn back around for me. So just bear with us. We're improvising here. So I'm gonna have you lift up your hands out. Can you come around down here? I'm gonna have you lift out your hands. Okay, arms are symmetrical and they're symmetrical in size, and colors are equally the same on both sides. Hair are distributed the same. Nail beds are clean, and there's no clubbing of the fingers, and capillary refills is less than 3. Patient doesn't have any lesions, doesn't have any sores, no open cuts on the hand. Can I have you flex your wrist like this? Okay, down. Okay, can you bend at your elbow for me? And then just I'm gonna pull your elbow, just keep me from pulling down. So strength is equal on bilaterally. Put your hand down. Okay. Next, I'm gonna go ahead and examine his legs while we have him up here. So I'm gonna have you hold out your legs for me. Legs are equal in size. Colors are the same. He have a like an old area here. May have been a scar. So he has a scar on the anterior shin of the right leg. And now I can go ahead and feel for his femoral artery, his tibial artery, pulses. These are the pulses I'm feeling for in the dorsopedial. Okay. And for his arm, I would also feel for the brachium and the radius. Okay. And next, I'm going to have the patient, let me go ahead and inspect his feet while I have him here. Hold out your feet for me. We can do one. And they're dry, brown, no lesion, cracks, and capillary refill is less than 3. And I would do that on both sides. I'm going to go ahead and have the patient lie on the sofa. On this, I'm going to be checking the patient abdominal bowel sounds. And I'm going to be doing palpations on his abdomen. Come over here, baby. Okay, come over. Next, I'm gonna listen to his bowel sounds. I'll do that first before I start palpating. I'll listen to the right upper quadrant first, then the left upper quadrant, the left lower quadrant, and then the right lower quadrant. I will listen in each quadrant for 5 minutes, and I'm looking for hypoactive bowel sounds or hyperactive, and then I'll palpate. Do you feel any pain?
No, ma'am.
Okay. No?
No, ma'am.
Okay. Your bowel movements are fine?
Yes, ma'am.
And then also, while I'm doing this, I can feel for the palpate for the border of the liver. And I will feel for the border of the pancreas on this side. Any pain when I palpate here?
No, ma'am.
No. Okay. Also, I can also feel for the, listen for the aortic pulse, and I can also listen for the renal arteries here. Okay. Are you okay? Are you comfortable?
Yes, ma'am.
Okay. So next, I'm gonna have the patient lift up his leg. I'm gonna test his leg strength here. Can you lift up your leg? Okay. You just pull him down. And next, I'm gonna mark his foot on the bottom to see. Okay, I'm checking for his reflex. Is this difficult for you? Okay, there were no fanning of the toes. I can understand it was difficult, but it was no fanning of the toes. Okay, I'm gonna have you stand up for me. Okay, can you turn towards me? Okay, I'm gonna have you bend over for me. Okay. The spine is midline